Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day. Welcome to Health Matters. I'm Hawa Solomon. With me, Dr. Shaida, sharing the platform today as we highlight diabetes. It is Diabetes Month, and this is something that it's not people that are affected, but those around that are affected by the loved one and that, very close person that has diabetes. Today we are being informed all about diabetes with our dietitian in studio with us, Ashley, as well as Dr. Debbie, who will be giving us an informative show today. Welcome, ladies, and very good day to you.
Thank you very much.
Thank you. Thank you so much for joining us. I know that even at this time of year, it's a busy schedule, and Dr. Shaida as well, being available to share the platform as we highlight diabetes. So, Dr. Shaida, should we start with first finding out what diabetes is all about?
Yeah, I think that's such an important thing. We all seem to talk about diabetes, and as Hawa has so beautifully said, that we are all in some way or another directly or indirectly affected by diabetes. So perhaps we can start off with Dr. Ashley sharing the platform and telling us more about diabetes.
Sorry, Dr. Debbie.
Dr. Debbie, sorry.
Dr. Debbie.
No problem. So I think the easiest thing to first understand is what is diabetes. So there are more than two forms of diabetes, but the easiest way to think of it is type 1 and type 2. So type 1 diabetes typically occurs in children, in young adults, but can also occur in full adults. And what it is it's an autoimmune destruction. That means your body attacks itself and kills the pancreatic beta cells so that you have an absolute deficiency of insulin in your body, which causes high sugar. Whereas type 2 diabetes usually occurs in an older person and presents the same way with high blood sugar, but it's due to primarily insulin resistance, so the inability of insulin to work, to get into the cells and do its work, and to take blood glucose or sugar out of the bloodstream and into the cells to work. And over time, patients will often tell you that they started off on tablets, but they landed up on insulin. And it's not because they now became a type 1 from being a type 2, but it's more because they started off with opposition to how insulin works, and then an absolute insulin deficiency as time progresses.
So you spoke from very young as well as to full adult age that they have to live with this. Is it a process when they are diagnosed, and what sort of checks are done if they possibly diabetic?
So I think the hardest thing is to recognize the diagnosis. It's a very non-specific diagnosis. Often presents with, in adults, it's a lot easier because they can tell you their symptoms of thirst, polyuria, which is drinking all the time, urinating all the time, nocturia, urinating at night, being hungry all the time, weight loss. Whereas children, it's non-specific. They're often just lethargic, aren't performing well at school, aren't reaching their abilities, and you can just kind of get the sense that something's off about them.
So if I can ask Hawa, I think you mentioned about a young age. What is the youngest age that a child has been diagnosed with type 1 diabetes?
So that's a great question. I'm an adult physician and endocrinologist, so I never see kids this age, but we certainly have patients that were diagnosed from about 4 months old. So it can occur as early as that, and it probably would present at that age with a failure to thrive, poor feeding, lethargic all the time, not reaching milestones. It would be a quick period before diagnosis is reached.
You've mentioned some of the symptoms. Are there any that, as you said, in children that are not present as well? And then also, what about pregnancy?
So pregnancy is a whole different kettle of fish. So people can be pregnant with pre-existing type 1 or type 2 diabetes, or normal people can develop gestational diabetes in pregnancy. That means that they were normal before, and in the pregnancy they became diabetic. It's not so much that they would present with certain symptoms that would alert you. It's more having a high degree of suspicion to the likelihood of developing diabetes that you have to be aware of. So any woman who's got a strong family history of diabetes, who's got polycystic ovarian syndrome, who's obese, who's previously had a child that weighs more than 4 kilos, who has previously had gestational diabetes in a prior pregnancy, who's got sugar in their urine called glycosuria, those are the people that you need to be aware of and screen for diabetes.
Okay.
Now, you said something about pregnancy and diabetes. So after the pregnancy, does that mean that the diabetes disappears?
Goes away.
Yes.
So in gestational diabetes, there is a chance of that happening. And typically that will occur after delivery. Within a couple of days, you usually do see some reversal, because the main cause of gestational diabetes is that the placenta, the baby's placenta, starts to secrete hormones that oppose the action of insulin. So either the diabetes will settle and go away, or it will persist. If it persists, you'll know about it. After delivery of the child, the glucose values won't return to normal. Whereas if it goes away, the woman remains at very high risk of developing type 2 diabetes in the future, 30% risk.
Oh, I'm just wondering, in terms of diet and diabetes, and
So now we have to bring Ashley in. So, like, often people come to you, Ashley, when they've also been diagnosed. Just quickly tell us sort of the feelings around, being, infected with the diabetes, coming to you with this condition. We are there before we get into the nitty-gritties emotionally. Do you get a feel of that?
Definitely, they come in, quite distraught. I had a patient yesterday, actually, that was newly diagnosed type 2, and they just think that their whole lifestyle is needing to change, and often that's actually true. So they're very overwhelmed with information. What is insulin? What is blood sugar? Does blood sugar have anything to do with blood pressure? All of these sorts of questions. So it's very important to take them back to what has their doctor told them in terms of, do you understand what diabetes is? And have they given you any advice in terms of what you should be eating and what things you should change? So like Dr. Debbie said, type 1 diabetics don't produce any insulin. So they have to be on actually a very, very specific diet in terms of how often they eat. Type 2 diabetics tend to have to change their lifestyle in terms of perhaps they're very overweight and they need to start exercising. They need to look at their diet. So, a lot of different things come into play, but you really have to consider each patient individually and look at the type of diabetes that they have.
So what I'm hearing you say, Ashley, is that there isn't actually a blueprint, a one-size-fits-all. One has to tailor-make it and actually look at the uniqueness and the constitution and genetic disposition of that individual patient.
Definitely. You can look at two patients who have exactly the same, onset and the same weight, or they were the same age, and put them on the same diet, and they will react differently. So you normally start off with a diet, even type 1s that are, very specific. You start off with a diet and you tailor make it to them. You also have to be aware of the fact that perhaps if you get sick or you get the flu, it will change your blood sugars, and you'll have to be aware of that. So constant testing and constant monitoring is one of the big things that we follow up with patients after they've seen the doctor. Then they see us maybe a little bit more often, and we say, are you testing? How often are you testing? Are you taking medicine as it's prescribed? All of that sort of stuff. So it has to be continuously followed up with.
Absolutely, I'm sure it's a process and a hands-on process. Dr. Debbie, quickly with you, you've explained to us sort of the symptoms, the type 1, type 2 conditions. What are the real causes? Is it genetic? Is it outside, inside? What's happening? Why are people being affected by diabetes?
So that's a great question.
Yeah.
Maybe a little bit easier answered in type 2 diabetes. So let's start off by saying it's multifactorial. There's always a genetic predisposition. In fact, if one parent has type 2 diabetes, you're almost at a 30% risk as a child of developing diabetes. And if two parents have it, almost a 70% risk. So there is a large genetic predisposition, but the rest is life, unfortunately. And I think that every one of us is guilty of not being able to do what we should do. Obesity is on the rise in South Africa and is certainly associated with comorbid illnesses like diabetes and high blood pressure and cholesterol problems. There's a lot of unexplained epigenetic factors, so environmental exposure to chemicals that happened many years ago, things that you cannot do anything about right now, as well as epigenetics that changed our genes at least 20 years ago. So those are things that you really can't worry about because there's nothing you can do about it. You can only tackle your life and how healthy you are right now, being aware of your risk and trying to attack those risk factors to keep your risk of developing diabetes down.
So I like what you're saying about attacking the possibility or the potential for risk of being pre-diabetic or developing diabetes. And I think what it came out in this discussion is the physical activity, avoiding a sedentary lifestyle, but also watching one's diet and managing, what your intake and what you're absorbing and how you're living your life. And perhaps you can share more about managing one's lifestyle and the potential of avoiding developing.
Okay. Before Doctor answers that question, Dr. Shaida, we need to take a short break and, of course, invite our listeners to call in with your diabetes questions. Back in a moment. Assalamu alaikum. Welcome back. A very good evening, and this is Health Matters. Welcome, and remember, we are inviting your questions, so please do call us. We have specialist physician in studio with us, Dr. Debbie and dietitian Ashley, who will be highlighting the very, very important life that we need to live when we are diabetic, Dr. Shaida. So just before the break, I rudely interrupted.
No, I think we've got
We're
our
going to the
experts
lifestyle.
here,
Yes,
and
yes.
they can enlighten us, they can enlighten the viewers about lifestyle management and the risk factors.
Absolutely.
So I think that it's critically important that people exercise at least 3 times a week, at least 30 minutes a week. That is critical to preventing diabetes.
If you can expand a little bit on what type and kind of physical
that's a good
activity.
question, yeah.
So generally a balance between aerobic and anaerobic exercises are recommended, or as we think of it, more cardiovascular exercises, as well as weight training. What is important is that you do a specific duration, so you need to hit about 30 minutes 3 times a week as a minimum. That isn't the maximum, that's the minimum. In order to achieve some weight loss, you have to increase it even more than that. Diet, I'll leave to Ashley.
Before we get to diet and that exercise, I've got a few questions there as well, but we have got a caller. Welcome to Health Matters. A very good evening.
Hi there, thanks very much. I have a question about people who've had bariatric surgery. I've heard that following that sometimes diabetes is reversed almost immediately.
Okay, did you get that?
I did.
Who are we speaking to?
Lisa,
Lisa, where are you calling us from?
Woodmead.
Thank you so much for your call. For your call, thank you so much, Lisa from Hoodmead. Doctor?
Lisa's correct. Lisa is correct. So bariatric surgery changes the gut hormones in your body and promotes weight loss that way. It's not due to having a smaller stomach so that you don't absorb nutrients. It's actually on a gut hormone level. And diabetes can be kind of cured. It doesn't necessarily mean it's going to happen to everybody, and you need to be monitored. And in fact, we only say that diabetes is in remission some years after the bariatric procedure. But it is a treatment modality for diabetes, and you certainly can be diabetic in name and be off all treatment.
Okay.
But similarly, if you are diagnosed early with diabetes and you take your diagnosis seriously and you work towards weight reduction and exercise and healthy eating, you can also have diabetes in name only and be on very minimal treatment.
So you can lead a healthy, a free lifestyle without actually suffering
labelled,
the symptoms of diabetes.
Absolutely. And not only is it important to prevent the diagnosis from even happening, but once you have diabetes, it's very important that you control it and control it well so that you do not develop the long-term complications of diabetes that everyone hears about, the blindness, the kidney failure, the heart attack, the strokes, the foot disease, the amputations.
That just gets to me when you hear,
And I think something that Hawa said during our break about life-threatening. So what you're actually alluding to, that if it's not managed adequately or properly, it could be life-threatening.
Absolutely. The problem is that once you've developed those big complications of diabetes, once you already have had your strokes and your heart attacks and you're in kidney failure and you're on dialysis and you've got amputated feet, there's very little you can do to slow down that process. So it's quite critical that you actually manage it appropriately right from the get-go to prevent those complications from happening.
Stressing the seriousness of it. We are taking your calls. The number is on the screen. Don't forget Diabetes Month. And we have specialist physician in studio with us, endocrinologist and dietitian, and they'll be helping us through learning and helping us create a healthy lifestyle as well. So let's get on to the diet. But before we do that, quickly, Dr. Debbie, you mentioned about the exercise. I just want to quickly get to that because often, people are coming to you, maybe they're obese, they're not able to do the exercise. How helpful is it to get somebody to help them with that? Because, of course, the first port of call is your dietitian, but what about a personal trainer or somebody that sort of knows about that?
So I think this is where biokineticists do the job very well.
Okay.
They're experienced in designing an exercise program and understanding the limitations and comorbidities of the patients. So they're not there to hold your hand while you exercise, but they certainly are there to formulate a program taking into account your health. And it doesn't mean that it's always easy, because it's not. It's not always easy. But
Easier
there
said than
is
done,
a
yeah.
way.
Absolutely. We're going to get to Ashley in a minute. Dr. Shaida, we have another caller online. This is Health Matters. A very good day to you. Welcome to the show.
Hello.
Hello, yes, you've got a question for our specialist in studio
Yes.
on diabetes. Please go ahead, sir.
Okay, thank you. I'd like to find out from the panel that, if you do a glucose tolerance test, would that indicate that if you are going to become diabetic in the future or not? Would that be important, or is that advisable to do it once or twice a year?
You got that, doctor?
Especially when you're maybe you're 45, 50, outdoor, but no family history,
Yeah.
but just for the sake of safety.
Sure. Thank you so much, sir. Shukran. Okay, doctor, you got that?
Okay, so the question is, should you do a glucose tolerance test where you drink a cup of sugar water and you analyze the body's ability to bring down glucose twice a year or yearly in somebody who doesn't have risk factors but is concerned that they have diabetes? No. The answer is no. It's even though it's not a very expensive test, it's still a clinical test, and tests have to be indicated. So if somebody's got no risk factors, then they would be better monitored clinically using a finger prick glucose test, which can be done at the bedside by any general practitioner. And a random glucose above 11 millimoles per liter is diagnostic. I think the hard thing comes in is even for general practitioners and other doctors out there, when they do find that a random blood glucose is above 11, they generally panic and worry about giving a new diagnosis of diabetes and send the patient for additional tests. A blood glucose above 11 on a day when a patient is not ill and is completely well is diagnostic of diabetes in the face of symptoms. So you really are after somebody feeling tired all the time, weeing all the time, hungry all the time, maybe losing weight because that high glucose is driving weight loss. So it might not be a very good thing. So you've got to have a good index of suspicion, and doing a glucose tolerance test prophylactically is not a good idea.
You alluded to some of the symptoms there, and just something that came to mind is sometimes the confusion, the disorientation. Is that also not symptomatic of when the sugar levels are imbalanced?
Yes, but more likely in an older person. A younger person is not likely to become confused from a high sugar. In saying that, you certainly do have diabetic emergencies where the sugar is extraordinarily high. And in that situation, certainly you can become confused and even comatose.
Tell us quickly about the sort of confusion when there are tests done and doctors quickly rush off to diagnose diabetes. I've heard through family, maybe there's the thyroid issue. Are there other, condition or predisposed to something else when they quickly jump to diabetes?
So diabetes is diagnosed because a patient has symptoms that are suggestive. possibly risk factors that you've already identified, and then you can either use a few modalities. So you could either use a fasting blood glucose, even a pinprick finger, that is more than 7.0 millimoles per liter, a random glucose of 11 or more millimoles per liter, an HbA1c. An HbA1c is a laboratory test that shows how much glucose is coating a red blood cell. And that value above 6.5% is diagnostic of diabetes, or a glucose tolerance test where you drink a cup of sugar water and your blood glucose fails to normalize in a certain amount of time.
Is this a once-off test, or does it
It's a
happen
once-off
during
test
period?
usually.
Okay. All right. Let's get to the
Yeah,
diet.
actually, we're waiting to hear about the diet. I think that's everything that Dr. Debbie has
Lifestyle
spoken
and
to,
diet,
but
yeah.
I think it was very important. But in terms of diet, of course, how diet influences or could contribute to the diabetes, and then how to manage it and how to avoid diabetes. So perhaps there's three, it's a loaded question, but you can respond to that.
Yeah, so definitely when you get a diagnosis of diabetes, you want to encourage the patient to be aggressive. So you want to, if they are sedentary, you want to suggest, okay, let's see the bio, let's get you started on an exercise regime. You will immediately do a food frequency and a food recall and see what are they eating, how often are they eating it, who is preparing the food. That's quite important. So many patients, particularly men, aren't preparing their own food. So you need to then say, okay, well, please bring your wife in because she's preparing your food next time and she needs to understand exactly what's happening. And then in terms of the diet, you're looking at, first of all, excessive portions. So what size portions are you eating? And you might say, I actually don't eat that much. My portions are quite small. Your small portion and my small portion will be very different. So you need to get very specific about how much they are eating, and then obviously what they are eating. Are they eating a lot of processed foods? Are they eating a lot of high sugar foods and high fat foods? And then also obviously you look at their weight, you look at their waist circumference, and you basically need a plan. We need to get a plan in order. We need goals in mind. It's important to give patients goals that are, you have a big goal and then you have smaller goals, okay? And they should see improvements even with the smaller goals. Okay. So in terms of the diet, you want to make sure that people aren't going long hours without eating.
I'm also thinking what she's talking about this food plan, family plan, but also bringing in the family.
Yes.
I like that. I think it's a
Absolutely.
brilliant concept where you bring in the significant others into the picture, because that patient needs support, guidance, direction, and everybody needs to be empowered and educated.
Absolutely. Let's talk about that after the break and realistic goals and plans. We'll take a short break, but we'll come back with more on diabetes just after this. Assalamu alaikum, a very good day. Welcome back. This is Health Matters. I'm Hawa Solomon, with me Dr. Shaida, sharing the platform today as we discuss diabetes, the lifestyle changes, how your family needs to get involved, how to get diagnosed, what are sort of the symptoms, and also just like simple questions. If you've got a question for your doctor, we have specialist physician in studio with us, and often people are so scared to ask questions, even the simplest question, like even how I'm feeling, and we have to highlight how this is actually a family change happening if that member is diagnosed with diabetes. Dr. Shaida, let's look at the family.
Yes, Ashley, if you can come back and inform us. We just said how brilliant it is to bring in the significant others to enable, empower them so that they could support, guide and direct the patient.
Yeah, so it is very important that you have the whole family unit understanding exactly what is healthy, what is right to eat. Just because the patient will feel quite overwhelmed, we want them to feel supported. And actually in general, a diabetic diet is a healthy diet. So often the changes that are made to the diet are not ones that limit the rest of the family members. They can actually improve the diet of the rest of the family, you know, so limiting your sugar intake, eating more vegetables, eating more lean protein, proteins. All of those things are good, healthy options. They don't limit the rest of your family, so why not?
So then is it possible for the rest of the family to be on that diet as well?
Definitely, yeah.
Okay.
It's quite
Just like some extra Tabasco sauce on the side.
yeah. So they'll be less limited in what other things they can have. But in general, your main meals can definitely, a diabetic diet can be incorporated into the main meal of any family.
So can a diabetic diet be enjoyable?
Definitely.
That's a good question. That's a very good question.
No, definitely. So it's not that you now have to take out every single flavoring or anything like that. You have to be just very careful of what ingredients you use and cook most of the food yourself. So if you cook the food, you know what's in the food.
And
So
you're avoiding the preservatives,
yes,
etc.
and all of the extra sugars and all of that sort of thing, and try cook as many whole foods as you can. So when thinking about food, it's very, very simple, particularly your carbohydrates. Try and think, does this come from a packet or does this come from the ground? Did the earth grow it?
Important, very important.
More whole foods, less processed rubbish.
And if you were able to identify, be more specific on the types of foods, if you can just actually identify.
Yeah, let's
definitely.
understand what are we not sometimes meant to have. And as you say, whole food, raw foods, how do we cook them? Are we cooking away the goodness? Yeah, just some guidance.
So definitely the main macronutrient that you want to look at is your carbohydrates. They have the greatest immediate effect on your blood sugar. So you want to stay away from obviously your sweets, your sugary drinks. So for example, your Cokes, your cold drinks, even fruit juice. So a lot of patients, when they tell me that they have 100% fruit juice, they do not realize that they are essentially almost drinking a
So
Coke.
I'm itching to ask you the question, the diet Cokes and the zero
Yes.
drinks.
So there's two schools of thought on that. So the one school of thought is that it has no sugar, therefore it has no effect. The newest information is to say that it still causes a release of insulin. So we're talking more for your type 2s. It still causes a release of insulin because your brain tastes that it's sweet. So your brain can't differentiate between sugar and an artificial sweetener. So your brain thinks that there's sugar coming, it releases insulin, there's no sugar. So it could possibly be making type 2 diabetics insulin resistance worse. So what you really want to look at there, and you always hear this from a dietitian, but is moderation. So the occasional Coke Zero is not going to hurt you, but drinking 2 liters of Coke Zero, replacing it, from 2 liters of Coke, probably not the best.
Absolutely,
Look more at your
yeah.
water.
Fascinating, eh, Gawa? Fascinating.
No, I know. And even the point about fruit. Often we don't know how much sugar is in that fruit. And we're thinking fruit, it's
Healthy.
good. It's healthy.
Yeah.
It's supposed to be healthy. I want to just check on sugar levels. We've got a caller that mentioned, what are your sugar levels meant to be in the morning when you wake up? Because of course you're sleeping for a long period, and then at nighttime when you go to bed again.
Okay, so a person without diabetes, sugar levels are usually below 6 in the fasting state, and that is what we're aiming for. So if your sugars are above 6 fasting, you might have what's called pre-diabetes, and you might need further testing. When you are already diabetic, whether you're type 1 or type 2, we're generally aiming for before breakfast readings of around about 6, 7, definitely not higher. And I think that's the disillusion of most people. As long as it's under 10 or under 12, then they feel that they are well controlled. No.
6 is the number.
No. 6 is your number. 6 and 7 is your number. Okay. And after a meal, about 2 hours after a meal, around 7.5, under 8 is a good number. So we're never 9s, 10s, never.
Don't wake up with a 9.
Dr.
Good way to
Debbie,
go.
I just want to ask you, we know that there's always concern when a diabetic is inflicted with a wound or an injury. Why so?
That is because of compromised wound healing on many levels. So the first thing is that wounds typically affect your feet. Often patients have what's called a peripheral neuropathy. That means they've lost sensation to their feet because their nerves are damaged from diabetes. So they won't feel a wound.
So you're speaking to poor circulation.
So poor nerves, so they don't feel that there's a wound.
Wow.
Then they need their eyes to see that there's a wound, and they might not see well. So now wounds are advancing before you've even seen that you've got a wound. It might already be secondarily infected. Then you've got a blood supply that may be compromised because of atherosclerosis or other contributing factors. You've got poor blood supply, and in that blood supply, the white cells themselves are affected by diabetes and don't fight infection so well. So it's multifactorial why a simple little wound on your foot lands up being a big story and can land up with an amputation.
All right, so now this leads to the question of what an endocrinologist really does. What is the study?
I don't know what an endocrinologist does.
I was struggling to say the word. So.
We all struggle to say our own titles, so we just call ourselves endos. Much easier.
You could have told me that.
An endocrinologist is a specialist physician who's subspecialized in hormones and metabolism. You know some of the things without realizing you actually do know what an endocrinologist is. Some of the things we specialize in are obviously diabetes, thyroid illness, osteoporosis, what else? Growth hormone, pituitary diseases, adrenal diseases, obesity. These are all hormones and all the role of an endocrinologist. Unfortunately, in South Africa, there are under 100 endocrinologists in the country.
Sure, we need much more. Eh?
So, if I'm correct, from what I've learned, is that endocrinologists work with a lot of obesity as well, and people that are insulin resistant. And what is the type of treatment that you follow?
Okay, so insulin resistance is a diagnosis given to somebody who's essentially not type 2, it doesn't have type 2 diabetes, but is really on the path to getting there. And you know that they're on that path because their fasting glucose is above 6, remember our golden number, but not at the diagnostic threshold of 7. And similarly, you could use other blood tests like HbA1c to give you that same sort of feeling. And that's been labeled colloquially as pre-diabetes. There are obviously more tests, such as a glucose tolerance test, which needs to be done. If you're on the brink of diabetes, you need to know, are you actually there or are you just not there? And the important thing is to prevent the progression. Diet and exercise has been shown to prevent that progression from pre-diabetes to diabetes more than any other drug.
So, Dr. Debbie, I just want to say, is it overdiagnosed, the insulin resistance?
Okay, let's just check if there's a caller online.
Okay.
This is Health Matters. Assalamu alaikum, very good day. Welcome.
Hi, I'm calling from KZN.
Yes, welcome to Health Matters. We have endocrinologist and dietitian in studio. Do you have a question?
Yes, I have for the doctor.
Dr. Debbie, go ahead.
Yes,
Go ahead.
She mentioned that when you do your reading in the morning, it should read around 7, 6 or 7.
Yes, golden number.
If it's around 9, what do you do?
Okay, thank you very much for your question.
Thank
We
you.
appreciate it. Okay.
Okay.
9, you mentioned 9, hey?
Okay.
So what do you do?
So you immediately know you have a problem. I take it that you have diabetes already diagnosed.
Oh, the call is gone.
Oh.
Yeah, sorry.
Okay, so let's assume that she is already
She does have,
diagnosed.
sorry, she does
Okay.
have.
So then you know that your glucose is not controlled. And you have to take a closer look and see if this is just a once-off. Did you cheat the night before? Did you snack? Did you wake up at 2 in the morning and pig out on things? Or is this a pattern?
Okay.
A once-off reading I wouldn't really panic about.
Okay.
But if it's consistent, it tells you that your diabetes is not well controlled. If you're only on tablets, you might need escalation to more tablets. If you're already on the maximum dose of tablets, your doctor will tell you it's time for insulin.
Okay, we want to talk about insulin, but there's this fear of needles already, not even having needles present. But quickly, and I'm going to leave that quickly to Dr. Shaida, but I want to talk about diet and the fruit that we left off. Often people say, oh no, I had a fruit salad, and then their sugar spikes or something happens. Tell us about our fruits and the intake of the sugars within them. What should we be staying away from? Some dangers around the real fruits.
There's no fruit that you should not have
Okay.
or not, you should limit from your diet, but you should limit the amount of fruit that you have in one go, and you should spread it out throughout the day, and generally you should have a fruit with something else. So with a protein generally, it helps to lower the GI of fruit. So you still want to get the benefits of fruit, which would be your antioxidants, your fiber. Obviously it's a natural thing. So but it can cause a spike in the blood sugar if it's eaten far too much. So I have patients coming in telling me that they, for breakfast, have a fruit smoothie, and they're having like 4 different fruits in one go. They're getting 60 grams of sugar in one shot. So you really want to look at not only the fruit in and of itself, but what you are having it with. So we always pair a fruit with some nuts, and normally as a snack, or if it's part of a meal, then you have to look at the rest of the meal as well.
Dr. Shaida, literally we have, our time has run up. We have a minute
just the
left.
treatment, I think quickly in terms of the treatment for diabetes.
Complicated. Starting off with exercise and diet is a given. An absolute given, and no medication is a substitute for the basics of changing your ways. But then there's oral agents, there's quite a few, and then there's insulins.
Okay, so unfortunately that's where we have to wrap. Your last words from the dietitian.
Just in terms of any diabetic, if you are struggling, come and see your doctor, come and see your dietitian, and the more informed you are, the better you will be at managing your diabetes.
And Dr. Shaida?
No, I just think it was so informative, brilliant. I think there's a lot of takeaway home points for us to consider and implement in our lifestyle.
And for me was the golden number 6, guys. So thank you so much, Dr. Debbie, our endocrinologist, sorry.
Endo.
Yeah, Endo, there we go. And Ashley Gibbon, our dietitian. Thank you so much for your time. We really appreciate it. And we hope that this evening's show was an ultimate benefit for you and your entire family. Let's not forget that.
Yeah, definitely.
Absolutely.
Definitely,
Shukran so much
indeed.
for being with us. From myself, Dr. Shaida, shukran so much once
Shukran.
again.
Assalamu alaikum wa rahmatullahi wa barakatuh.
And from myself, Hawa Solomon, wassalamu alaikum and goodbye for now.